The keys to taking good pictures is a good setup with good lighting and reproducibility. I use a blue backdrop for my photos. Studies have shown that blue does not skew the borders, as there are no colors that naturally occur on the skin that match this blue color. You want to position your lights to eliminate as many shadows as possible. You should have lighting in front of the subject, behind the subject, and in between the two front and back lights. You can also have a light head-on to further reduce shadows. I use 3 spotlights on each side of the subject with a ring light head-on. I have the chair set at about 17 inches away from the back wall, and the front legs of the tripod for the camera are set 27 inches away from the back wall. These numbers were arbitrarily set, but I set my lights based on the positions and maintain these settings in order to have reproducible images. For pictures of the face, I always have the client sitting, facing forward. The camera is always in a fixed position, as I previously described, and I used a fixed zoom. Usually I use 1.6 times for photos of the face. I attempt to set the camera height so that the top of the lens is level with the center of my field of focus. For example, in this project, I tried to align the top of the lens with the nose so that the nose is the center of the field of focus and the rest of the treatment area is easily visible. Step 1. Surface heating. In this step, I keep my hand moving at all times. I do not focus on one specific area. I like to move my hand as if I am using a paintbrush painting the entire area. Clients may feel discomfort in areas where the bone is more superficial, such as over the zygomatic bone. In this case, you want to be sure to keep moving in these areas. You also want to continue to monitor the skin reaction as well as the skin temperature light on the handpiece at all times. Step 2. Subdermal heating. For this step, I perform each pulse individually. I want to make sure that I have no more than 5 to 10% overlap between pulses. On average, it takes about 10 to 20 pulses to complete one cheek. I like to perform 3 to 4 passes per side for this step. And this step can become uncomfortable, especially with the cooling spray, so topical anesthetic is important. Step 3, Sandro Lift 1. This is a setting where you have your frequency set to 8 Hz. So there's another time you want to keep your hand moving at all times. Once again, I keep my hand moving in a painting-like motion with the same precautions as in the surface heating step. You want to try to achieve 1,000 to 1,500 pulses per side in 1 to 3 passes as tolerated by the client. Step 4, Sandro Lift 2. This step is the same frequency, motion, as well as safety parameters as Step 3, Sandro Lift 1. In this treatment step, you are using a larger spot size, which is decreasing scatter and delivering more energy to your treatment area. So once again, you do want to pay very close attention to your temperature as well as the skin reaction and the patient's comfort. In this step, you want to try to achieve 500 to 1,000 pulses per side in 1 to 2 passes as tolerated by the client. Step 5 is your under eye circle reduction. Of note, this treatment is in a very sensitive area, very thin skin, so numbing is very important for comfort. For this step, I do remove one of the eyepieces at a time, and I protect the inferior portion of the globe as well as the eyelashes with a tongue depressor during the procedure. In this procedure step, the positioning of the handpiece is extremely important. You want to assure that the bar on the back side of the spot size attachment is against the tongue depressor, because if the tongue depressor or an eyelash gets in the way of the laser beam, it will cause the energy to be placed at a more superficial point, and there will be a high risk of burning the skin in that case. Once again, you want to assure there is no more than 5 to 10% overlap between pulses, and you want to perform 3 to 4 passes on each eye as tolerated.